Then I explain mechanism of action. So normally adrenaline increases heart rate by acting on beta 1 receptors. When we give a beta blocker, the beta 1 receptors are blocked and the heart rate will be decreases. This is called negative chronotropic effect. Next, the beta blockers also reduce the force with which the heart contracts. This is called a negative inotropic effect. Because of this, the cardiac output decreases, heart workload decreases, oxygen requirement of heart decreases. This is extremely useful in disease like angina and ischemic heart disease. Next, effect on blood pressure. It depends on cardiac output and peripheral resistance. Beta blockers reduce blood pressure mainly by reducing heart rate, reducing cardiac output, and reducing renin release from kidney. Less renin means less angiotensin 2, less aldosterone, less sodium and water retention. So blood pressure slowly comes down. That's why beta blockers are long-term BP controlling drugs, not emergency drugs. And the beta blockers effect on kidney is very important concept. The beta 1 receptors are present in juxtaglomerular cells of the kidney. When beta blockers block these receptors, the renin release decreases, RAA system is suppressed. This helps in hypertension, heart failure, and post myocardial infarction patients. This kidney action is one of the key reasons beta blockers save lives. So types of beta blockers. Some beta blockers mainly act on the heart. These are called cardioselective beta blockers. For example, atenolol, metoprolol, bisoprolol. These are the cardioselective beta blockers. They mainly block beta 1 receptors, so they are relatively safer in asthma, but still should be used carefully. Some beta blockers block both beta 1 and beta 2 receptors. These are called non selective beta blockers. For example, propranolol, etc. These drugs can cause bronchoconstriction, so they are not preferred in asthma patients. Some beta blockers also cause vasodilation. For example, carvedilol, nebivolol. These are very useful in heart failure because they reduce the heart workload and improve survival. And the uses of beta blockers mainly it used for hypertension, and also it reduce heart rate, cardiac output, and renin release. So BP reduced gradually and it remains controlled. Next, angina pectoris. Angina occurs due to imbalance between oxygen supply and oxygen demand. So beta blockers are reduce heart rate, reduce force of contraction, reduce oxygen demand. So the chest pain is prevented, and also used for heart failure. Heart failure. So beta blockers were avoided in heart failure. Now we know chronic sympathetic stimulation damage the heart. The beta blockers protect the heart from stress. They are started in low dose and increased slowly. Next, the beta blockers slow down the AV node conduction and it control abnormal rhythm. So it very useful in supraventricular arrhythmias. And also the beta blockers reduce mortality, prevent sudden cardiac death, reduce risk of reinfarction. That's why almost every MI patient receives a beta blocker. And other uses of beta blockers are anxiety, tremors, migraine prevention, hypothyroidism, portal hypertension. Next, the adverse effect of beta blockers. Beta blockers reduce the heart activity and they can cause bradycardia, fatigue, cold hands and feet. And the non-selective beta blockers may cause bronchoconstriction. In diabetic patients, they may cause hypoglycemia. And the beta blocker should never be stopped suddenly. Sudden withdrawal can cause severe tachycardia, hypertension, angina, and myocardial infarction. So always taper the dose slowly.